Hey guys, Dr. Childs here. Today we're going to be talking about Hashimoto's flare-up symptoms, and we're going to be talking about how to tell if your thyroid gland is inflamed, specifically based off of your symptoms. So if you are somebody who has Hashimoto's thyroiditis, then you know, because you're living it, that your thyroid function will fluctuate over time, right? There may be times when you're feeling good, there may be times when you're feeling bad, and what I want to do is talk about how to tell when you are actually in a flare-up, meaning your thyroid is doing worse than it would normally, meaning your immune system is flared up, meaning that immune system is damaging and attacking your thyroid, and that is impacting how much thyroid hormone is being produced, and that will impact your symptoms. But things can get a little bit confusing because these symptoms do sometimes correlate with thyroid symptoms, but not always, okay? And as we talk about these symptoms, this will kind of make a little bit more sense. And remember, as we go, and if you have questions, you can leave this below, but remember, you cannot be both simultaneously hyperthyroid and hypothyroid in the same tissue at the same time. You can have some symptoms of hyperthyroidism in other tissues and some symptoms of hypothyroidism in different tissues, but not in the same tissue simultaneously, okay? And we'll talk about that a little bit later. All right, so number one symptom would be sudden or unexplained weight gain. And I'm talking about just out of the blue weight gain where you're living your life normally, you're doing everything that you would normally, you haven't changed your diet, you haven't changed how much you're sleeping, you haven't changed how much you're exercising, and all of a sudden you're just gaining more weight. Now, this can also be seen as an increase or sudden increase in more weight than you would gain normally. So yes, it is true, unfortunately, that patients with thyroid problems, they will tend to be overweight and they will tend to gain weight more easily than someone who does not have thyroid problems by virtue of how the thyroid helps to regulate your metabolism. So sometimes, unfortunately, patients are gaining weight. But if you let's say normally you're gaining 1 or 2 pounds a month and suddenly now you're gaining 2 to 4 pounds per month and you haven't changed anything, that is often a sign that something is going on and your thyroid function has abruptly worsened, all right, almost immediately. So a sign of a potential flare-up. Number two would be sudden or worsening fatigue. So again, a lot of thyroid patients tend to have fatigue at baseline, but if all of a sudden you notice a worsening in that fatigue or more debilitating fatigue, that's often a bad sign. The next one would be heat in the neck or thyroid gland area. So this is more of a specific symptom, but it is one that I see a lot of patients with Hashimoto's endorse, and that is they feel that where the thyroid gland would sit, there's a lot of heat emanating from that gland. So when they touch it, it feels warm to the touch, and it's just a general sensation in their throat that something is wrong in that area. Now, this is probably because when you have Hashimoto's thyroiditis and your immune system is attacking it, it is generating some heat, right? Because there is inflammation in that area. Now imagine if you have, let's just say hives for some reason. If you have hives on your skin, you touch your skin, it is actually hot, right? If you know, that's because the inflammation is present. So inflammation does generate heat and that heat can be felt. Now when that heat is being generated from inside of the body instead of on the surface of your skin, it's a little bit more difficult to assess. But since the thyroid gland is so superficial, meaning it is very close to the skin, some of that heat can probably be emanated from through the skin, and then you can probably feel that when you touch it. So that is one of the symptoms that I've seen as well. Another symptom that can occur is thyroid pain. This is an uncommon symptom, but still can occur. Normally, thyroid pain is associated with thyroiditis, with subacute thyroiditis, or an infection of the thyroid gland itself. But it can also be associated with Hashimoto's, just very rarely. Based off the studies I've looked at, it's usually somewhere between 2 and 5% of people. So it's unlikely if you have pain, it's associated with Hashimoto's, but it could be, right? Most of the time, pain in the thyroid gland is associated with a different condition called subacute thyroiditis. But again, about 2 to 5% of patients with Hashimoto's and those people who have flare-ups will experience that thyroid gland pain. And that obviously is something that you will not miss because it hurts every time you move your neck or your head and you touch over that area. Another symptom people experience includes difficulty swallowing or feeling pressure in the neck when talking, eating, or drinking food. So, and this makes sense because if the thyroid gland is just enlarged, just look at your neck. There's not a lot of space there. So if something is getting bigger and pushing from the inside out, it's going to put pressure on all of the things that are normally happening there. That includes breathing because that's where your trachea is. That includes drinking and swallowing and eating because that's where your esophagus is, right? It actually sits in front of the trachea, but the esophagus is normally in like a sort of flat closed position. So if there's pressure pushing it, making it even harder or more closed, if you will, as you imagine this, then when you consume food, it's going to push back against that and you might feel that, okay? So there's a sensation that something is just not right there or there's an extra pressure inside of the neck. And again, that is probably because there is some degree of thyroid gland inflammation when you have a flare-up by virtue of the mechanism by which Hashimoto's thyroiditis works. We also have general feeling of weakness or malaise. So malaise is just sort of when you just feel blah. You just don't feel like getting up. And malaise it can occur in a lot of conditions, including regular illnesses. Like if you get the flu, malaise is one of those symptoms there. But what I mean by weakness and malaise here is that you just don't have the normal energy that you would otherwise on a day-to-day basis. Maybe you just lack the motivation to get up. Maybe you're just feeling a little bit, more fatigued than you would normally. But it is a little bit different than fatigue, because fatigue just means you have the energy to do it. Fatigue has to do more with energy, and malaise has to do more with how strong you are feeling. So they're similar, but they are a little bit different. Next one would be new onset joint pain and or muscular pain. So joint pain and muscular pain can be associated with thyroid function, usually a decline in thyroid function. But if you have been living your life normally without joint pain or muscle pain, and all of a sudden it just comes out of nowhere, that is usually a bad sign and can be an indication related to a flare-up. In addition, there are some people who already have joint pain and muscle pain as well. So if you feel that muscle pain is getting abruptly worse, just suddenly, right? Not slowly. A slow progression probably has more to do with thyroid function, maybe your thyroid medication. I'm talking about an abrupt worsening of that pain. That may be an indication of a flare-up. Next would be a new racing heart or sensation of palpitations. Now we're kind of going into the category of hyperthyroidism, and I will talk about that a little bit later, but I will mention it here. And what can happen when your thyroid gland gets inflamed because of a flare-up in Hashimoto's? Most of people think of it as, well, it's being damaged, therefore it's not producing enough thyroid hormone, which means I'm going to have a low thyroid, right? That's generally the progression and how people operate and how they think about it. But it is also true that inflammation can result in excess production of thyroid hormone, which can result in hyperthyroid symptoms, including things like racing heart and sensation of palpitations. Because if your immune system is attacking your thyroid and it gets a flush of thyroid hormone that gets pushed throughout the entire body, you will temporarily feel that hyperthyroid-like symptom or that hyperthyroid-like state, and that may feel like a jittery sensation in the heart or heart palpitations, which again can occur in Hashimoto's. It's not common, but it can occur. You might also feel like you have a jittery sensation, maybe an uncomfortable rush, or what I refer to as nervous energy. This is the kind of energy where you feel like you have energy, but it doesn't feel good, right? It's not the type of energy that you want. The type of energy where you're like, I can, get up and run 3 miles, no problem. That's good energy. Nervous energy is when you have problems closing your eyes to relax, you can't sleep, your mind is racing, you're not able to just shut things down. That's the sort of nervous energy, the jittery sensation, and the uncomfortable rush I'm talking about here. Again, that is often associated with a Hashimoto's flare-up. Another set of symptoms have to do with the brain, and these include abrupt onset of brain fog, difficulty in concentrating, or the inability to focus on difficult tasks. So this would be an indication that something has changed in terms of thyroid function, not so much related to the immune aspect, but definitely related to thyroid function. We also have changes to gut motility. So this usually results in constipation, but it can also result in diarrhea. So any abrupt change one way or the other may be related to your thyroid, not always, because that can be controlled by other things, including anxiety and some things like that. So you can't hang your hat on this one particular by itself, but if it's associated with these other symptoms, then that may be a sign it's all coming together. Next, we have acute symptoms of hyperthyroidism or acute symptoms of hypothyroidism. So remember, during a flare-up is sort of different than the normal progression of Hashimoto's thyroiditis. So most people, when we look at Hashimoto's, they develop Hashimoto's and their thyroid function gets damaged, and then it just goes low, and maybe it kind of comes up and down back to normal, but never goes high, right? That's the normal progression for most people. And then eventually they'll end up low over a period of time. If we're talking years and years and years, they'll end up low. But some people actually have a different route. Some people go hyperthyroid, then they go hypothyroid, then they go hyperthyroid and hypo and so on, and then they almost always end up low, but they do have these bouts of hyperthyroidism. These bouts of hyperthyroidism typically occur during flare-ups in these particular people. And this can be very confusing for a patient with Hashimoto's, because in their mind they're thinking, wait a minute, I'm supposed to have low thyroid function. I'm supposed to have the symptoms of weight gain, hair loss, constipation, cold intolerance, but I'm having the complete opposite. I'm having racing heart, jittery sensation. I'm having hair loss, but it's a different type of hair loss. I'm also losing weight. Those are all symptoms of hyperthyroidism, meaning the thyroid is too high. Both conditions can result from a flare-up. That's where it can kind of get a little bit confusing because of the mechanism which I explained previously. And that is, if you have any sort of inflammation or damage to the thyroid gland, it has two options. It can either release more thyroid hormone or release less. Now, most of the time it releases less because there's not enough there to begin with, right? But in some people, there is enough, and it gets pushed out, it gets flushed out of the system. And even though it is from Hashimoto's, people often get confused by that, and they think, wait a minute, do I have Graves' disease? Do I have another cause of hyperthyroidism? What is going on here? But really, it's still the same disease. They just have a different path. They're just taking a different path. So I want you to keep all these in mind when you talk about your flare-up. So when we talk about the flare-up, I had a video which I really talked about the triggers of it. Now, the symptoms are important because they can help you determine that something is off. But once you have determined something is off using the information in this video, your next step should be to look for the triggers, because identifying the triggers is the way to treat the problem. The symptoms are good because they tell you something is happening, but they don't tell you why it happened or how to treat it. So in order to do that, you'll need to go to that video to check out the triggers. But if you're just wondering, what are these things that I'm experiencing? What are the array what type of symptoms may I experience if I have a flare-up? This is the video for you. If you have any questions based off this information, leave a comment below. I'd be happy to help. If I can, I try my best to answer all questions in the comments. I don't get to all of them, but I try to. And if you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information, all designed to help thyroid patients like you feel better. So otherwise, that's all I have for you guys today, and I will see you in the next one.